right, welcome everyone to Health Programming at Your Library from the network of the National Library of Medicine. We are glad that you are here today. My name is Jessie Vandervolgen. I am the Associate Director of our training office based in Salt Lake City, Utah. And I have just a few informational things to get us started today. If you would like, there are captions available by clicking on the CC button at the bottom of your screen. If you don't see that CC button, you can locate the three dots at the bottom and then select close captions from there. We've muted our microphones to your microphones today to cut down on our background noise, but we still welcome your participation through comments in the chat along the way. One of the things that past participants have enjoyed about this class is actually the exchange of ideas with others. So please don't hesitate to share yours. Rebecca Brown from the NTO is here to help me out today with a link to the handout and monitoring for questions to make sure that I don't miss any of them. So if you send a message in the chat, make sure it goes to everyone so both Rebecca and I can see them, and we'll make sure to get to those questions along the way. We are recording today's session. It can take up to about 30 days to get everything done correctly, but after that, everyone who registered for the session will be emailed a link for the recording, so keep an eye out for that. If you have to duck out early, we do understand. Our class today is eligible for 1.5 credits from the Medical Library Association for continuing ed, and we'll provide some more information on that at the end. And then finally, just one more mention of our handout for today's session. You don't need to complete it for that CE. It's just like a guided note-taking and has some useful links in there. So if you click on that link in the chat, you will download to your downloads folder as a Word document. All right. Let's get started. So when you think about health reference, which picture most closely resembles how you feel? Feel free to put your response in the chat, and if you're up for it, add a little note on why. While you're thinking about that, I'll mention that picture A is some hands planting seeds in the dirt. Picture B is a raft in white water. Picture C is an overhead view of a large maze. And picture D is a ballet dancer. What do you think? Be fun and terrifying. I like that, Nicole. Like you don't know what's around the next bend, but we're gonna have a good time getting there. Thank you, Katie. A and D, like the start of something, planting seeds, and then it feels great once it's going. Yeah, I like the planting seeds. C is the big maze. What are you thinking there? Because I'm not sure what I'm doing, and sometimes you get a little bit lost trying to find your way out. Yeah, all of it depending on the audience and the topic. Yeah, thank you. Yeah, we all bring some different feelings, experiences, and expectations about planning and implementing health programming in our communities. And I want to mention that this is not a full how-to class, but the idea here is that you'll get some information and some resources for getting started or getting some new ideas in this area and hopefully sort of move your confidence to where you feel like you could plan a new program for your community. So where we're going today, we'll discuss why we might conduct health outreach in a library, create an initial plan for the development and implementation of health outreach programming at your library with ideas from big to small, identify some potential partnerships as well as resources from the National Library of Medicine and some other agencies to support your programming. I also wanted to just briefly introduce the network of the National Library of Medicine if this happens to be your first time in one of our webinars. The NNLM is part of the National Library of Medicine, which is within the National Institutes of Health. And we work regionally, getting to know communities on the ground and helping those communities and libraries serve the people that they know. We have funding, we have educational programming, and other types of outreach. So we hope that if this is your first time here, that you'll be back to connect with us again. Um, the two primary links for today, the slides will be available to you, as well as the handout with links and activities for you to follow along to start planning your health program. Okay, let's start with a little more input from you. Um, the spectrum of ways to incorporate health outreach and programming is very wide. It can be something passive or some active multi-day or month-long type of programming. So outreach might be a library partnering with a local nonprofit to provide free menstrual products, or a program might include a session for seniors about how to find reliable health information online. So let us know if you have seen anything lately that has caught your eye. Any examples of health programming that you've done at your library or maybe you've read about online that you thought sounded interesting. Presentation on how to find a family doctor. Pods for telehealth and online programs. Blood pressure screenings. Yeah, I have those. Menopause, shredding the silence on I'm reading this backwards a little bit. Menopause, panel discussion, period poverty, donations, get the community to help. Yeah. These are all types of health programming because they impact the awareness or access to health in your community. Why do you think it might be a good idea for libraries to conduct health outreach? What are we doing as libraries that makes it a good idea for us to conduct some health outreach or programming? So libraries are often our community hubs, right? Public libraries across the country get up to 4 million visits per day. People, like you said, are already visiting the library. Many people consider libraries to be trusted providers of information and community resources. The Pew Research Center in 2016, so it's getting a little old now, but reported that 38% of people using libraries did so to seek out health information. The other reason is libraries, we know our communities and their needs well, and we also often have existing partnerships and with local resources that are in tune with the needs of the community. So libraries can be a great place to sort of bridge some of those access gaps, not necessarily for care, but access to the information and sometimes care. Um, in today's complex information environment, we have the opportunity and responsibility to communicate the resources and expertise that exist in our communities. So showcasing those. Libraries, community centers, faith-based organizations are often heavily utilized when someone has a question on just about any topic and are often the starting point for information on health. It's also good for the library. Enhances the image and visibility of the library or organization in the community, keeps us top of mind for our users and our boards or other municipalities, governance boards. Um, Adequately preparing for health programming and outreach is one way to sort of stay in tune with the current or changing health needs of your community. And then events and resources around health programming help to showcase your value to your community members and leaders as well. So just a quick note to sort of recognize where we are today in the health programming and outreach landscape. We hope that you're going to enjoy learning about some resources and projects, find some information and inspiration, but don't feel overwhelmed and compelled to do all of the things. These are ideas and not necessarily best practices. You best know your library and your community and your capacity. So recognizing the staff capacity, the funding insecurity that many of us are facing, and social and political pressures, I want to say that all of those are going to play into what you can and choose to offer in your setting. slides are being a bit funny here. Let's go back one. Okay. It's like sticky. So if health outreach is new to you and your library organization, it may be helpful to begin by locating information on your community's health needs. And this is actually the first competency of the consumer health specialization offered by the Medical Library Association. Learning about the demographics, the health issues, the strengths and challenges of your area is going to help you better meet the needs of your community and create programs that really align with those. And that alignment will help make a better impact. And secondly, grant funders like the NNLM and other organizations are going to require some justification for any funded program activities. So it's always good to make sure that you can demonstrate how the projects that you're requesting funding for are in alignment with the needs of your community. I know that as librarians, we are in tune with the needs of our community, but step one to planning health outreach is knowing where to find those quality statistics to back up what you might already observe or feel about your community. And so I'm going to give an overview of 3 resources that can help you learn more about community. We'll look briefly at all 3, and then I'm going to give you some time to explore them for your community. So State Health Facts provides free, up-to-date health data for all 50 states, the District of Columbia, counties, territories, and some other geographies. The data comes from both public and private sources like the Kaiser Family Foundation, public websites, government surveys, and other organizations. And this resource focuses on providing information at the state level. So if you're interested in offering a program on diabetes, for example, you could find information on health status indicators for your state on diabetes and information like the percentage of adults who have been told by a doctor that they have diabetes. This is where you'd go for that. The second resource is the County Health Rankings and Roadmaps. A service of the Robert Wood Johnson Foundation is an excellent place to start looking for information about health issues in your community. And as you might guess, this website is going to provide health data at the county level. So you would choose your state and your county and then scan through the data to get a sense of the information there. This is an example of a county health rankings page. I pulled Salt Lake City, Utah, because that's where I am. And if you look in the upper right, this graphic tells me how my county fares compared to the rest of Utah and the rest of the U.S. So Salt Lake County has better health outcomes than the average county in the state and the nation. Below, I've selected a particular health outcome, which is premature death. And if you look below it, you'll see a definition of what does premature death mean. And you'll also see how recent the data is. So this is from 2019, 2021. You'll also see this itty bitty graph icon that you can further explore trends in the metrics. So which direction is it going? And then finally, back in that upper right corner, I'll point out that you can download the chart for use in a report or a presentation or to look at the data on a map. Some of the metrics in this source you can disaggregate by race or ethnicity to examine for health disparities in your community. Here's one more snapshot of the county rankings and roadmaps. Near the top of the table, there is a checkbox for show areas to explore, and clicking that box will highlight any red flag areas in the county that are potential challenges to health. And so this can be one way of figuring out some of the issues that your community might need more awareness, more screenings, more resources for. You can also show areas of strength, which I think is useful too, because a lot of times we're looking for, where can we add to things, but building on strengths is also important. So you might use this if you need to justify things like purchase of materials for a program on a given topic to your board, trustees. You can use the information to locate the statistics for your county and compare that to other counties in the state, that there is a need to raise awareness on a given topic. And then finally, narrowing down a bit more, is the third source is the City Health Dashboard. This allows you to see where the nation's 500 largest cities stand on 36 key measures of health and factors affecting health across 5 areas, including health behaviors, social and economic factors, the physical environment, health outcomes, and clinical care. In this case, I pulled up the air pollution metric, and so the bar will show you how Los Angeles compares to the other counties in the dashboard. So the average of the dashboard cities is 27.2 and Los Angeles is 27.3. I also like that it tells you at the end here whether lower or higher is better. So it will have a green check mark if the city that you selected is better than the average of the cities in the dashboard. And so one thing that you can notice here is that while Los Angeles as a whole has only slightly worse air pollution than the other cities in the dashboard, if you look through these census tracts, which are what these little boxes are, there are certain areas that are subject to notably higher air pollution than other areas of Los Angeles. And so you might use that information as well when you're thinking about the programming or outreach that you might offer. These dashboards are so rich, and you could spend a long time looking at them. You can look at a city overview to see how a city is doing compared to other cities in the dashboard, and then zoom in on particular aspects to get more detailed geographic or demographic information. I have Charleston, South Carolina, which is the home of our Region 2 pulled up here. And overall, Charleston has lower incidence of high blood pressure than other cities. But again, looking at that map shows you that it's actually a more complex picture than one single number can relate. And you can look at the other factors. These are the physical environment factors, but you can see the behavioral health and other things too. Okay, I know you are eager to check these out, and I'm eager for a sip of water. So if you have the handout handy, what I'd like you to do for our first activity, this is a little bit of a choose your own adventure. You're going to pick one of the resources that we just mentioned and explore and learn about your area for a few minutes. Come back, and in the chat, we'll have you share which source you used and what you learned or confirmed, if it was something you already knew, that might inform the health programming that you offer. I'm actually going to be quiet for about 5 minutes so you can just dive in and explore a little bit, and I'll be back with you in just 5 minutes. Okay, folks, we're coming back online here. Feel free to share in the chat what resource you used and what you found. Anything that might inform programming needs in your area. Eileen has said that they have a pre-diabetes event scheduled in 26, and that the data backs up that choice, that it's very much needed. And Katie in Ohio, looking at the city of Columbus, it doesn't feel very walkable, but it is around the national average. Yeah, maybe our cities on average are not that walkable. Any other findings that might inform the types of things that your area need? Anyone just enjoy the dashboards? Yeah. Thank you, Christina. Diverse, segmented city, higher than average uninsured population. Information literacy fairs, health fairs. Cool. State health facts from Jay Scott, heart disease. Yep. Apparently, your over 85-year-old population has a high percentage going up. I might have missed the context for that, Raman. Looking at your community's strengths on the resource. Yeah, that is a good point. Um, State health facts, data for alcohol abuse disorders in your home state. Yep. So you hopefully got a taste of how you might use these if you're thinking about programming or justification for when you're asking for funds for health programming or allocating funds for health programming or even allocating some of your time to know that you're spending it in the right direction for your community. Okay. Once you have had a chance to review your community's needs, where do you even begin? So for your initial planning, you first want to identify your intended or primary audience, and then the type of outreach or programming that's appropriate for this audience, right? Teens will be different than parents of young kids, will be different than older adults in terms of the type of programming that's appropriate for them. And I want you to keep in mind that health outreach doesn't have to be a full-fledged 1-hour program, speakers and activities. Really consider the spectrum of engagement and what might be manageable and meaningful based on your primary audience's needs. Maybe they just want to grab a flyer to check out later. It might be highlighting a particular information resource or offering one-time or ongoing programming. And then you also have to consider the staff and physical space that you have available to offer that type of programming. If you want people to be willing to do it again, to engage in it again, it has to be something that has not overloaded the space and time that people have. So this is where we get into the like ideas of health programming. Here are a few categories of ideas to get you started. One might be food access, so it can be food pantries, cooking programming, gardening, movement activities, hosting a physical activity like a story walk or yoga, including chair yoga, or injury prevention. It might be access to care, partnering with someone for a vaccination clinic, diabetes education, smoking cessation, support groups, having space for support groups, chronic disease management. Some libraries now have embedded social workers to help folks access services. Technology programming might be telehealth services or digital literacy projects. For children and families, you might have a sensory story time or music and movement. In the veterinary aspect, you might have partner with someone for a vaccination clinic or pet first aid, pet loss and grief, or promoting curated lists of key or sensitive topics. And that's what you see. The pictures on this slide are a couple of examples. So Carnegie Library of Pittsburgh offers bookmarks to help teens find materials on sensitive topics without having to ask a library staff member. Penn Hills Library, you can see a picture of their large food pantry. The Rockwood Makerspace in Multnomah County, Oregon has a teen health hygiene center. And the Central New York Library Resources Council had the Healthy Pet Project, which included workshops on how to prepare for disasters with your pet. So a wide variety of programs. Let's talk about a few more and some considerations. When you're thinking about the type of programming that you want to add, um, really think about the unique needs in your community that the library or the library in combination with a partner is a good fit for. Gather some evidence, and it's okay to just start with simple ideas because those are easier to start and easier to maintain. And when you're sort of considering a project, one of the things I always like to ask myself is, can I easily explain to someone else why this is beneficial and why we should be doing it? A couple cautions. We do recommend that you avoid competitions, especially though anything focused on weight loss. If you're inviting people into the library space, um, you do so with an eye toward caution. There are companies that sell supplements or diet plans that may be interested in finding an audience or space in the library, so you do want to vet who you're bringing in. I also will mention here that registered dietitians and nutritionists are not the same thing. Anyone may call themselves a nutritionist. A registered or licensed dietitian is a recognized medical professional who has passed a national exam. So just a note if you're bringing folks in to offer programming and know what their credentials are and what their background is. When working with new partners, authors, or speakers, make sure you're kind of considering a spectrum of opinions and care and practices. A couple more inspiring ideas to share with you. This somewhat recent Newsweek article featured how libraries are becoming health hubs for food and fitness classes. Menominee Falls Public Library partnered with the American Heart Association to have blood pressure readings, which I believe someone mentioned at the beginning of our session here with an idea that you've seen recently. This is a event calendar from Cobb County, Georgia, and you can see how many different health programs they have here, and they're not doing it all themselves, right? It's through partnerships to offer yoga, to offer vaccinations and Medicare counseling. So some other ideas. Okay, so if some of these stories don't have your wheels turning yet, we have some more idea sources. So I'm going to do the same thing that we did the last time. I'm going to briefly describe these websites and then invite you to explore on your own because each person here is going to have a different sort of track that you'd like to kind of pursue. So Let's Move in Libraries has program ideas, resources, and examples of library programming focused around movement and active living. It also has advice for where to begin, creating accessible programming, and what to do with liability. The ALA Programming Librarian, you can browse and search library programming ideas. So you might search health, but it also includes a search by budget and by age group. So you can get tips on planning, who to look for partners, marketing, budgeting, and other advice for carrying out the program. It's a really incredible resource. Web Junction has Health Happens in Libraries. You'll want to check out the resources list. This is less a list of ideas and more of a dedicated resource for helping you develop your health programming, including some webinars, communication ideas, and some detailed examples of projects. It is a very deep resource and very much worth exploring to make any health programming that you want to do a lighter lift for you. Things like sustainability, helping your library be autism ready, creating a garden program or a community pantry, and much more. The Rural Health Literacy Toolkit is a program clearinghouse specifically dedicated to rural libraries with a focus on health literacy. Ready.gov has emergency preparedness training and programs resources as well as social media toolkits. J. Brewery Storytime includes some programs for storytime with children that incorporate things like food and movement, so related to health. You can also browse some of the NNLM past funded projects and current funded projects that describe who the primary audience was intended to be and what the project was. And then the National Health Observances resource has toolkits and resources from the Office of Disease Prevention and Health Promotion. And these fall more in the raising awareness category. So now it's time for activity 2. These are linked in your guide today. Because not everyone is going to be interested in the same types of programming, I'm going to again give you a few minutes to explore one or two of the resources that are appealing to you. And you can see if you can find a program that might match up nicely with the community need that you've identified. So again, you're going to hear quiet for about 4 to 5 minutes and then share back any ideas that you think would connect with your community's needs and which resource you used. Okay, have fun. Hi, folks, coming back to you now as you're probably just diving into some of these resources. I invite you to share back if you found anything that you think would connect with your community or any other observations about some of the resources that you explored. Katie, thank you. I remember the Know Your Flow presentation. I've seen programs on menopause have been very well received. Love that. Anyone else find anything that you liked? I know it's hard to take the time to type it out. RHI, some good resources for writing grants and a program that from North Carolina that looked adaptable. Yeah, ready.gov and the flood information for emergencies. They September is Disaster Preparedness Month, so NNLM just had a bunch of programming about library preparedness that you might want to check out if you didn't have a chance to yet. Let's Move in Libraries chair-based exercise program, minimal attendance. Okay, needed a chair for, okay, healthy eating and fitness events. I love the Story Walk program too. Let's Move in Libraries kind of details that one. You could do it even just around your building or at a spot in the community. I think those are kind of fun. Yeah. All right. Well, thank you for sharing those back. I hope that with a little bit more time, you'll get some other ideas. And it's so much nicer to take the lessons learned and their resources from one of these where folks have taken time to share what they've done and then to build on and copy the successful elements than to create something completely from scratch. Let let's all build on each other's great ideas and share those back. Okay, so when you're planning, you've got your audience in mind, um, and you want to begin to think about who you might be able to partner with to enable or enhance the outreach or programming activity. So the partners that you might want to bring in may have some particular expertise, or maybe they know the audience very well. They might have materials or some other resource that your program would need for success. And so one effective way to do health programming is to partner with a local organization who needs a location or space that has goals that align with yours. And sometimes they reach a bigger population by coming to the library. They might not have an accessible entrance, or they might not have a place that folks really know about. And so by coming to the library, they reach more folks. These are some types of partnerships to consider. Your local government or public health offices, the library of your community college or university, or if that's where you are, partnering with your local public library, some of your healthcare providers, food banks, agriculture nonprofits, SNAP educators, cooperative extensions. If you have one in your area, they might do programs on food safety, nutrition, mental health, aging, and many others. I think very highly of those cooperative extension programs, and feel free to chime in the chat if you've had other successes with them. Sometimes your local authors and businesses. Who else might you add to your list of potential partners for all of us to consider? Feel free to add in the chat here. Who else should we consider partnering with based on your experience? State level public health? Yeah. that's nearby, or sometimes they'll be able to come out. Right? Nobody is walking through the state public health office for fun, but people are walking through the libraries, right? Hybrid programs. Sometimes grocery stores have a nutritionist that will give presentations. Yeah. Sometimes that's a good place to advertise programming too, depending on your community. Um, Academia looking to partner with your clinic. Yes. Hospital librarian, work at the public library, natural partnership. Yeah. Let's see, did I skip one here? All right, so we'll give you some examples of some partnerships. At Brooklyn Public Central Library, the young adult librarian Rakesha Kearns White noticed a need in her community, many young people experiencing period poverty. And so they were impacted by a lack of access to menstrual hygiene products. So the library partnered with a nonprofit called the Cycle Alliance to start up a period pantry. And so this resource has products, but also educational materials and resources on reproductive health. And it sounds like Katie could give us some information of what they've been going on in Ohio too. Uh, Chamber of Commerce and a leadership program started through the library. I think your library director would probably have a stroke if he tried a period pantry. Well, you gotta, I almost made a terrible joke to go with the flow. But uh, we'll just carry on and, just keep finding other things that do work for your leadership and your community. Another example is where a community need was identified and the library developed a project, found partners and funding to meet those needs. And I'm going to try to play this video for you. Rebecca and I were having a little trouble playing this within the PowerPoint, so I may have to switch gears here, but we'll give it a try. I absolutely love this video here. It's just gonna play right there. All right, here we go.
In Pottsboro, Texas, a rural community 90 miles north of Dallas, people have to travel to get to the doctor, and that's difficult for a lot of people here, and it's time consuming. There's no public transportation, nor is there any ride sharing available. So we stayed open throughout the pandemic so people could come here because people didn't have computers or internet subscriptions at home. Then we started getting a couple calls from people who wanted to have doctor's appointments. Libraries are perfectly positioned to work with telehealth because we're oftentimes the fastest internet connection in town. People trust librarians. It's a neutral space. We're accustomed to helping people with digital literacy skills. So it all came together to request funding to start a virtual health room here.
The original proposal that they pitched was to create a pilot telehealth site that would allow them to figure out best practices that they could distribute as a model to other libraries or other community organizations that are looking to do the same thing. And in that respect, it has been a resounding success. A crucial partner in this was also HSC Health, which is sort of the clinical support that they got for managing schedules, for setting up appointments with providers.
So as it stands right now, there are 77 counties that don't have a hospital. Telemedicine can be a real solution to a lot of these problems if we have both the equipment, and then you have to have someone special there to help lead the way and to acknowledge that it's actually safe.
NNLM made it possible for us to convert this old storage room filled with old books into a virtual health room, a room where people can come in, connect with healthcare providers, get the care they need closer to home. It's leading to people being healthier.
During COVID, I did not want to go sit in a doctor's office and expose myself to bigger things when I just had a minor health issue. So this made it where my safety came first, and it was private, easy, convenient. That's why I chose it.
It's a great model, and in fact, we've created a playbook because this is not about secret sauce. This is about let's make our communities healthier. Here's what we learned from this experience, and here's what we wish we had done a little bit differently. How fabulous would it be if all rural communities had this kind of access? Healthy people become healthy communities.
Whenever Pottsboro, Texas is on national news, I know we've done something worthwhile. And I am proud of being the first pioneer to do this, to be able to help other libraries across the country make this happen. And it's a reality now that would not have happened without NNLM.
Okay, so you've got some statistics about your community, you've brainstormed some ideas and partners, and now it's time to help sort of realize your idea. I'm going to share 2 ideas for formulating your plan, and then you can choose which best aligns with your organization and how you'd like to work. So the first is the 7 key questions, and it's to help guide you through the development of your activity. All these questions are multifaceted, but will help you recognize what pieces you have in place and where you need to fill in the gaps. So, and it's kind of like a journalism activity, really. Who is your primary audience? Who in your organization can assist in the planning and the program? Who in your community might be an expert or know an expert? Who are the potential partners? What type of activity do you wish to provide? Will you provide information? Will you offer a program? What are the community health needs and what evidence do you have? What are the resources that you can use? When will you offer your program? When should you schedule it so that your audience and your staff are available? Is it a one-time event? Should it coincide with a health awareness month or some other community event that's going on? Is it ongoing? Where will the program be held? Do you have the space? Is it a kit to take home? Could it be outreach to a senior center or a school? Is the location accessible to the participants? Keep in mind, why do you want to offer this outreach activity? Why will it benefit your library's community or your organization's community? How will you market the program? Are there specific locations where your ideal audience frequents? How will you locate speakers? And then the perpetual question of how much time you and other staff will have to allocate to this activity, how much money will it cost, keeping those things in mind. If you need buy-in from funders or other stakeholders, one way to explain your program or activity is through the use of a logic model. You feel free to let me know in the chat if you already have thoughts about a logic model. But a logic model is a visual representation of a program that illustrates how your planned activities are linked to your program results. So a well-constructed logic model can make it easier to plan outreach programs by helping you determine the resources and the activities that you need to get to those desired results. And they sound complicated, but they can be easy to use and very helpful to get from program idea to evaluation. So at the top, you would put the goal of your activity of program. And then you have the inputs are the resources that are used to support the activity of the program. The activities are the main things the project will do or provide and who it will reach. And the outcomes are how many and what sort of observable, tangible results will be achieved. You have short-term as a direct result, changes in knowledge, skills, or attitudes. And long-term is the sort of benefit to the community over time. At the bottom, you might also list some assumptions about the community or the environment, and external factors might be some of the positive or negative influences to keep in mind about the community, and you should sort of confirm those before implementing the program. This template shows the types of things that you might include in each area. For example, your inputs include time, money, equipment, The activities, what you will do, will you print bookmarks? Will you provide a class? Will you host a blood pressure screening? And the outputs might be that people have increased knowledge about evaluating health websites, or that they help their family members separate reliable from questionable information, or that they know their key health numbers. Logic models don't have to be daunting. This is a very simplified example for a children's story time from the Library Research Services. You can think about them as a little bit like an if-then statement. If we do or have the things on the inputs activity side, then we predict the outcome side will happen. And for this type, sometimes I think it's useful to actually work backwards. So the desired outcome is that caregivers and children learn early literacy skills. And so to get there, we're going to host a story time on early literacy. So that's our activity with an aim of 15 attendees. And to do that activity, we need staff time and supplies. If this way of planning appeals to you, there are many, many resources on developing logic models, but I just wanted to highlight it as a one way of planning. And so I'm going to again give you a little bit of time here to choose either the 7 questions or the logic model in your class worksheet. Begin to sort of like, okay, if you were to implement that idea that you found earlier or some other idea that you've had about health programming, what are those key things that you would be filling in there? I'm going to be quiet for about 4 minutes again and come back to you to see, which one you used and how well it worked for you. And obviously 4 minutes is super short, but we'll try it out. Okay, be back in a few. All right, bringing y'all back with me. As a quick side note, feel free to note in the evaluation if you think the time for the activities is too short, too long. But I invite you to share here, which method did you use? Did you like the 7 questions or the logic model? And was it useful in sort of organizing some of the thoughts about your program? Or were you ready to scrap it and do something different? Seven questions worked better for me than the logic model. Yeah. I can kind of imagine using both, like kind of developing the idea and the overall flow with one, and then sort of filling in the real details with the 7 questions. Yeah. Um, Jay, Scott, you like the logic model? Feel free to let us know what you liked about it, because sometimes I actually do like a simple logic model, but they're kind of hard to adjust to when you're used to just really like getting into the logistics of things. I like to use both to hit all the important aspects, right? Katie mentioned it's the why to sell a program in the logic model. Like, what are we really doing this for, right? If you need to sell it to a director or a partner. But the 7 questions really useful for getting into the details of like, how are we actually going to put on this program or actually do this? Yeah. So both can be useful. I do think the logic model speaks to funders or other stakeholders who don't maybe necessarily need the details of the program. Yeah. Okay. All right. Both are tools out there for you to use. If you've never used a logic model, I think it's fun to kind of place it in there and try it out. Okay, so your program or your activity is coming into focus. How are you going to get in touch with the folks that you want to reach? Feel free to chime in the chat. This is the like share ideas with each other. What kind of ideas have you used or seen that work well in your area? Is it a flyer at the desk? Is it posting at the senior center or the fitness club? What works in your area? This is the crowdsource part right here. Chime in. There are two sort of sources that you can go to here to think about, how you might do some of the marketing to get folks to come to your event. Think about the agencies in the community that your intended audience frequents. Is it the rec center, the senior center, the schools? Is it daycares? Or what areas of your organization are they most likely to be in? Sometimes it can be a little bit of a trial and error to determine which work best for your community. Some might be more traditional use of flyers or signage on bulletin boards and windows of local businesses, your website calendar, press releases, news feeds, social media sites. Okay. It doesn't have to be restricted to the walls of your library or your business. You've got local health clinics, might have flyers about upcoming events or database searching classes, hair and nail salons, child care centers, community and faith-based organizations in your neighborhoods may all be potential places for reaching folks. In the library itself, you might think about posting upcoming health outreach events right in the stacks where the health materials are, or other places. And don't forget about the power of word of mouth and personal invitation. I always like a good story about I came because the person at the desk invited me. Two resources listed here, the Public Library Association's Marketing Strategies page and the ACRL Library Marketing Outreach Guide are worth exploring for a couple more ideas. Some of the other idea sources that we listed earlier, like the Programming Librarian, also include some marketing strategies. Gosh, about 10 years ago now, we had the Libraries Transform initiative for increasing public awareness of libraries and the critical role they play in the lives and communities through education. The project itself has been retired, but there are actually still many assets available from the I Love Libraries website, including graphics, key messages, activity suggestions. NNLM also partnered with ALA for a Libraries Transform Health Literacy Toolkit. So there's some cool posters available here covering things like nutrition, aging, and chronic illness. So both a resource for graphics to share, but also some activity ideas that you might see in the Libraries Transform. I'll also mention that you may want to check some of the National Institutes of Health. Many of them have digital materials that you are free to reuse. So you may look under the community outreach or materials on their website to get some free printables for awareness type issues. This is an example from the National Institutes of Mental Health, and you can browse social media graphics and videos to share with your community by topic. Another example from NIH are some posters. This is from the National Institute of Child Health and Human Development about sort of the postpartum depression and anxiety for awareness types of things. And each NIH Institute and Center has materials for you to use. Because they are government resources, they are free to reuse and repurpose. Some ideas to get you started. Creating programs can be a lot of work and worthwhile, but sometimes starting from somewhere else can help you get a head start. Some examples of some NNLM partnership activities include Citizen Science Month or Community Science Month is participation by the public to aid real scientific research and discovery. NNLM has developed resources and programming with SciStarter, which is an organization focused on advancing engagement from the public in research. And so they have a directory of projects that members of the public can contribute to, like bird and insect counts, light pollution, animal behavior, and some gamified research on Alzheimer's disease, and many, many more. Each April, there's Citizen Science Month, and there are a number of activities that you can use in your library that you can host or or participate in. NNLM has also developed an online toolkit to help busy library staff host a popular and familiar library program, the Book Club or the Reading Club. The NNLM Reading Club is a curated list of health-themed books from a variety of genres to facilitate conversations on health and wellness topics. And so this can help people learn about health information, maybe reduce the stigma surrounding some diseases and health conditions. And the topics range from menopause to diabetes, caregiving, and environmental health. And they have a variety of resources. They include lots of different book types, including fiction, memoirs, graphic novels, young adult. And I'll give you an example here. Each topic has a curated list of resources such as videos on dementia and then several books for the health topic. And then each book includes a discussion guide that you can download and a social media toolkit, making it really easy to host a discussion. So this book is about Alzheimer's, and you can see we've got a discussion guide, you've got your social media toolkit, poster, a bookmark, and lots of other resources to go around with it. And I think, gosh, I need to go back a slide. There are over 40 or 45 topics now that are covered by the Reading Club. Other NNLM guides and resources for health programs and resources in your library. I have some free bookmarks and other materials to distribute. So I have some curated collections that feature tools and programs from the National Library of Medicine, National Institutes of Health. We have a public libraries resource guide focused on health information needs in libraries, including programming and collections, and additional guides and toolkits on things like maternal health, emergency and disaster preparedness, and other topics that may help you with programming. Okay, take a little bit about how to partner with NNLM to design and implement health programs and resources. NNLM offers funding for projects that improve access to health information or increase folks' engagement in research with research and data. We have 7 libraries that function as the regional medical library for your region. And if you are not already connected with them, I really recommend getting acquainted with yours for lots of opportunities. The easiest way to partner with NNLM is to become an organizational member, and any type of organization that supports health information resources in their community can become a member. The membership is free. And then you can potentially find some other partners in our member directory in your area. NNLM usually has some funding opportunities. Many of the projects that we highlighted earlier all receive some form of funding or support from the NNLM. And if you have an idea and you want some feedback on it before submitting it, that's a great place to get in touch with your regional medical library for a consultation. We have a proposal writing toolkit to help you with those funding opportunities. It's primarily geared toward NNLM funding opportunities, but it may also help you write proposals for other types of funding. Okay, and congratulations, this class earns 1.5 credits for the Consumer Health Information Specialization, which is called CHIS, a professional development program through the Medical Library Association that can help you gain additional skills in things like understanding your community, which we've done a little bit of today, finding and evaluating health information resources, a critical skill right now, and improving health literacy in community. And so taking a class earns you credits toward CHIS. Couple classes coming up, just give you a kind of taste of some of the things that we offer coming up: the Librarian's Guide to Consumer Health, providing multilingual health information. There's also Connecting Older Adults to Health Information, Medline Plus tutorial, prescription and over-the-counter drug information. We have a collection management class for consumer health. And We are at the just about the end here. I hope you've enjoyed learning a little bit more about health programming. I know when we take a class that has a lot of ideas, it can be a bit overwhelming and then the ideas get shelved pretty quickly. So I'd like to invite you to take a minute to just reflect briefly and jot down, the top 3 things that stood out to you and what your next step is in health programming so it doesn't get shelved so quick.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel or select a video thumbnail to watch another video from the channel.